When anything prevents blood flow to a portion of the brain or when a blood artery in the brain bursts, a stroke, also known as a brain attack, happens. The brain either ages or suffers harm in both scenarios. A stroke may result in permanent brain damage, chronic disability, or even fatality. What transpires during a stroke in the brain? The brain is the organ that manages our bodily activities, retains our memories, and generates our ideas, feelings, and verbal expression. In addition, the brain regulates a variety of bodily processes, including respiration and digestion. You need oxygen for your brain to function correctly. All of the areas of your brain receive oxygen-rich blood from your arteries. Brain cells begin to die within minutes of a blockage in blood flow because they are unable to receive oxygen. The result is a stroke. Symptoms. Pay close note to the moment the symptoms first appeared if you believe that you or someone you are with may be having a stroke. When administered quickly after a stroke starts, some therapy options are most successful. Stroke symptoms and signs include difficulty communicating and hearing what others are saying. You can sound confused, slur words, or have trouble following conversations. Face, arm, or leg numbness or paralysis. You could suddenly experience facial, arm, or leg paralysis, weakness, or numbness. Usually, just one side of the body is impacted. Attempt to simultaneously raise both of your arms above your head. You might be having a stroke if one of your arms starts to fall. Additionally, if you try to grin, one side of your mouth can droop. Issues with vision in one or both eyes. You could have sudden double vision, clouded or darkened vision in one or both eyes. Headache. A sudden, intense headache that comes on suddenly and is followed by vomiting, wooziness, or altered awareness may be a sign of a stroke. Walking difficulty. You could trip or get unsteady. Additionally, you can experience unexpected drowsiness or lose coordination. What kinds of strokes are there? There are two different stroke types. Hemorrhagic stroke. Bleeding stroke. Some people refer to a transient ischemic attack, TIA, as a mini stroke. Because blood supply to the brain is restricted for only a brief period of time, typically no longer than 5 minutes, it differs from other primary forms of stroke. 1. Stroke with ischemia. Ischemic strokes are the most common type. 2. When blood clots or other objects obstruct the brain's blood arteries, an ischemic stroke ensues. Fat deposits that accumulate in blood vessels or blood clots or other debris that move through the bloodstream, typically from the heart, and lodge in the blood vessels in the brain cause blocked or restricted blood arteries. There is a need for more research, although preliminary findings suggest that COVID-19 infection may raise the risk of ischemic stroke. Risk elements. The risk of stroke can be raised by numerous circumstances. Stroke risk elements that may be managed include risk factors for lifestyle, being obese, overweight, active inactivity, binge or excessive drinking, using illicit substances like cocaine and methamphetamine, medical danger signs, elevated blood pressure, using tobacco products or being among people who smoke, high triglycerides, diabetes, obstructive snoring, cardiovascular illness, such as atrial fibrillation, heart failure, congenital heart abnormalities, and infections of the heart. History of stroke, heart attack, or transient ischemic attack in oneself or one's family. The COVID-19 virus. Other elements linked to an increased risk of stroke include sex. Men have a higher risk of stroke than do women. Women are usually older when they have strokes, and they're more likely to die of strokes than are men. Hormones. Use of birth control pills or hormone therapies that include estrogen increases risk. Preventative drugs. Your doctor might prescribe drugs to assist lower your chance of having another stroke if you've had a TIA or an ischemic stroke. These consist of antiplatelet medications. Blood clotting. Platelets are blood cells. Antiplatelet medications reduce the stickiness and clotting propensity of these cells. Aspirin is the antiplatelet drug that is used the most frequently. You can get assistance from your doctor in choosing the ideal aspirin dosage for you. Your doctor could prescribe aspirin plus an antiplatelet medication like clopidogrel, Plavix, for a while after a TIA or small stroke to lower your chance of having another stroke. If you are unable to take aspirin, your doctor might recommend clopidogrel by itself. Anticoagulants. These medicines prevent blood clots. Heparin has a rapid onset of action and is suitable for brief hospital use. Longer-term usage of the slower-acting warfarin, Gentovan, is possible. Because warfarin is a potent blood thinner, it's important to follow the directions exactly and monitor your body for any negative effects. In order to track the effects of warfarin, you must also undergo routine blood testing. There are a number of more recent blood-thinning drugs, anticoagulants, that can be used to lower the risk of stroke in people. Dabigatran, Pradaxa, Rivaroxaban, Xarelto, Apixaban, Eliquis, and Edoxaban are some of these drugs. Savisa. They act faster than warfarin and typically don't need your doctor to monitor you or order routine blood tests. In comparison to warfarin, these medications have a lower risk of bleeding problems.